The title of this presentation is U.S. Filipino Adults Patterns of Complementary and Alternative Medicine Use and Medical Pluralism, a secondary analysis of 2012 National Health Interview Survey. The presenters of this research are Dr. Rhea-Faye Felicilda Reynaldo and Ms. Soyoung Choi. We would like to acknowledge that this work was partially supported by National Institutes of Health and Sigma Theta Tau International Phi Gamma Chapter research funds. 1/3 of the U.S. population have reported use of complementary and alternative medicine, but true use of alternative therapies by the U.S. population is rare. Most U.S. health consumers usually combine conventional and CAM therapies either for health promotion or wellness or to treat illnesses. The combined use of CAM and conventional treatment is a type of medical pluralism. Medical pluralism is defined as the adoption of more than one medical system in terms of health beliefs, behaviors, or treatments. Majority of research on medical pluralism in the U.S. have been conducted among the largest immigrant populations, specifically Hispanic, Chinese, and Asian Indians. There is, however, a lack of studies on U.S. Filipino CAM use and medical pluralism. Filipinos make up the 4th largest immigrant population in the U.S., with an estimated 3.9 million Filipinos living in the U.S., making them the 3rd largest Asian American population. U.S. Filipinos suffer from health disparities such as cardiovascular disease, diabetes, obesity, prostate cancer, and female breast cancer. The cultural health beliefs of the Filipino population and the colonial history of medicine could mean high use of CAM and increased medical pluralism engagement among this population. When the Philippines was colonized, religious workers were sent and they brought in Western medicine, but due to lack of supplies, Western medicine was mixed with local herbs, and then religious practices were also included in healing practices. Filipinos also have similar beliefs with other Asian countries, such as the healing principles of balance, or what we call timbang. Filipinos also believe on other causes of illness, such as mythical, personalistic, or naturalistic causes. There are some studies that have been conducted regarding Filipinos' medical pluralism, such as Matsuno et al., showing that Filipino Americans had higher utilization rates of alternative medicine compared to other ethnicities in Hawaii, and De La Cruz and Galang showing that Filipinos who have hypertension have included home remedies as well as consultations with Filipino folk medicine practitioners in their treatment. There is still a need for more research on Filipino health behaviors to ensure that culturally relevant health interventions are available to the U.S. Filipino population. Our study aim is to explore patterns of CAM use and medical pluralism of U.S. Filipino adults. Here are our research questions. We conducted a secondary analysis of the 2012 National Health Interview Survey, which is a public data set provided by National Center for Health Statistics and CDC. It is a survey regarding the health of civilian non-institutionalized U.S. populations, and this survey included the Adult Complementary and Alternative Medicine Supplemental Survey. We studied Filipino adults 18 years and older, and we had a 518 sample size unweighted count, which represents about 3 million plus Filipino adults in the U.S. when weighted. We used the following variables in our analysis, and we also did some recategorization of some variables specifically to look at the health conditions for which CAM was used as a treatment. Our statistical analysis included descriptive statistics, and we also conducted this analysis using IBM SBS statistics, using also their complex samples analysis techniques. This is to account for the multi-stage complex sample design of NHIS. So we found that the most common CAM therapies used by Filipino adults are multivitamins, multiminerals, herbal supplements, and chiropractic osteopathic manipulation, massage, and yoga. The most common top 3 CAM therapies indicated by U.S. Filipino adults include herbal therapies and yoga, tai chi, qigong. The most common types of health conditions for which Filipino adults use CAM for treatment include pain-related conditions, cardiovascular circulatory system conditions, and acute other conditions. And the most common reasons Filipino use CAM to treat a health condition was that it is natural, it has a holistic approach, and it can be practiced or done on your own. Friends and family members are the most common recommenders for CAM use. Our study was the first to assess CAM use and medical pluralism solely within the U.S. Filipino population. It is not fully understood why U.S. Filipino adults take dietary supplements, but it is possible that they use them to improve or maintain health. Only 1.3% of our sample consulted a traditional healer, but comparing it with a study in Los Angeles where 10.8% of Filipinos actually consulted a hilot, which is a Filipino folk traditional healer. Similar with other ethnicities, the most common health condition for which U.S. Filipino adults use CAM for treatment was for pain-related conditions, and about 2% of U.S. Filipinos used CAM to treat cardiovascular circulatory conditions, and this is comparable to some of the study participants in De La Cruz and Galang's study. U.S. Filipino adults also favored using CAM therapies because they were natural and used a holistic approach. This seems to subscribe to the principle of timbang. Filipinos are family-centric, with family cohesiveness having a significant influence on one's decision-making. This could explain why friends and family members are the most common recommenders of CAM therapies for use in treatment of health conditions. We have several limitations to this study, including the 2012 NHIS not really being collected in all states. This is also a cross-sectional survey, so findings may only apply to a specific point in time, and there was a potential for selection bias towards healthier populations. So in conclusion, U.S. Filipino adults do engage in a pluralistic approach to health by combining CAM therapies and conventional medicine, but more research needs to be done to further explain U.S. Filipino adults' pattern of CAM and medical pluralism engagement, specifically on how CAM use in this population affects individual patterns of accessing individual treatments. More research also on this topic will better inform nurses and healthcare professionals regarding the impact of Filipinos' CAM-related behaviors on their healthcare needs. And this is a list of our references, and you can request for them if you need to do so. Thank you very much for listening to our presentation.